Welcome to the Children's Cancer Cause series. We're so pleased to have Smita Bhatia with us today to share her expertise on issues around long-term follow-up care for survivors and the need to address disparities in access to follow-up care and the impact on health outcomes. Dr. Bhatia is professor and director of the Institute for Cancer Outcomes and Survivorship at the University of Alabama Birmingham School of Medicine, as well as vice chair for outcomes in the Department of Pediatrics. Welcome, Dr. Bhatia. Let's start with a big picture question. What are the biggest challenges in survivorship and long-term follow-up care?
Well, thank you for inviting me and thank you for having me here. The biggest challenges can be summarized as follows. First of all, as the survival rates have improved markedly for our childhood cancer patients, the number of survivors has grown. But what research has shown is that a large proportion of these survivors have long-term complications, which are fairly severe or life-threatening and can even be fatal. But the challenges that face our patient population is that our survivors are not aware of these complications often. The healthcare providers that they seek care from are also not aware of these complications. And our survivors are unable to maintain long-term follow-up and contact with the healthcare system that had provided them the oncology care, the acute oncology care. So what happens is that there's a break from their oncologist or the patients age out of that system, and then their care falls upon primary care providers and other clinicians who really are not fully aware of all the complications that can develop in these complex situations that our patients face. So those are the challenges that our survivors face. So going from head to toe, the complications are many. We can start with cognitive impairment, visual impairment because of cataracts, hearing loss, go on to pulmonary dysfunction, cardiomyopathy and heart failure, coronary artery disease, and then complications related to treatment, which are in the form of new cancers that these patients develop because of radiation or chemotherapy.